Top public health officials are warning Americans not to let their guard down, despite the growing optimism that the FDA could authorize a coronavirus vaccine sometime this week. White House Coronavirus Response Coordinator Dr. Deborah Birx says while a vaccine is critical, it won't save the country from the current surge. Hospitals across the U.S. are struggling to make beds available. Most of California is back under lockdown today with a new strict stay-at-home order that is affecting 30 million people. Those restrictions took effect last night. The state recorded more than 30,000 new cases in just one day yesterday. Many others are seeing a spike. David Begnaud is in Reno, Nevada, with more there on the situation.
You know, Nevada now leads the country when it comes to the number of people hospitalized with coronavirus per capita. We are in Reno in Northern California because they are now using a parking garage to treat COVID patients. They were running out of bed space in the main hospital. Now, they set this up back in April. They didn't want to use it, but they have had to. We're nowhere near patients, just FYI. They can treat 1,500 in here. They're discharging about 20 to 30 a day. I mean, the volume is incredible. And 8 months into the pandemic, nothing seems to be slowing down here.
Look at this. Where cars would normally be parked, there are now patients. 265 have come through this field hospital in just the last 3 weeks.
When you have to resort to a parking garage, you know things are pretty bad.
That means this is real.
Dr. Jacob Kieperman had just started his job here as an ICU doctor 3 weeks ago when he tweeted a picture of the parking garage turned field hospital right before patients arrived. Now, some on social media seized on the empty beds, suggesting it and the pandemic were fake. And one of those posts was retweeted by President Trump.
It was sad, disappointing, and frankly insulting.
The rampant spread of misinformation across the country is complicating efforts to control the pandemic. That's according to Dr. Deborah Birx of the White House Coronavirus Task Force.
And so I hear community members parroting back those situations, parroting back that masks don't work. This is not just the worst public health event. This is the worst event that this country will face.
To California now, where rising hospitalizations led to more regional lockdowns Sunday night by order of the governor. This affects more than 30 million people. Starting today, salons are closed, retailers are under strict capacity limits, and all dining, indoor and out, is suspended through Christmas.
If I'm not open by February, I will no longer be here. My restaurant cannot open for to-go.
Restaurant owner Angela Marsden is among those pleading with state leaders to change their rules after she noticed an outdoor dining tent for a film crew 15 feet away from her now closed outdoor patio.
Tell me that this is dangerous, but right next to me is a slap in my face.
The way it works in Los Angeles is that county officials classify video production work as essential and require regular COVID testing at TV and movie shoots. Back here in Nevada, where we are this morning, casinos and restaurants have a 25% capacity limit. Nurse Janet Baum says her hospital, which is the only one servicing 100,000 square miles, has never been busier than it is now.
Never in my wildest nightmares would I ever have thought that we would ever see something that would be killing this many people.
You know, when you listen to Janet, you hear her voice crack and you hear her tear up. You understand why people like Dr. Kieperman, who you heard from earlier in the story, said our people are exhausted. Not only are they tired, not only are they working without a vacation, but they're also getting sick, and we're having to rotate them out and bring in new staff. It doesn't get more viscerally real and honest than seeing this. A parking garage being used to treat people, because that's what it's come to 8 months into the pandemic. Vlad and Anne-Marie, back to you.
Absolutely horrifying, David. Thank you very much. Let's bring in Dr. Ron Elfenbein. He's the medical director and owner of First Call Medical Center. Dr. Elfenbein, you're at a coronavirus testing site right now in Severna Park, Maryland. What does the situation look like where you are?
Well, good morning. It's actually exciting because this is our first day, so I was here all weekend setting up. We have at a volunteer fire department, we set up a tent and trailer, and we actually have a whole bunch of people in line already waiting before we even opened. But so far, so good. It's looking pretty good. You know, we definitely need more testing sites, so we're trying to get them up as quickly as we can. It's freezing cold out today here in Maryland, so it's we got some heaters going, but you know, everybody's working hard, trying to stay warm too.
So you're out there testing people. I'm sure that some of those people may have, I don't know, gone out to dinner or done something over the weekend that made them think maybe I should get tested. We ran a piece earlier today, Dr. David Begnaud's piece, and in that piece, Dr. Deborah Birx said that she has heard members of the local communities that she's interacted with, parroting back misinformation about the spread of the virus. So we are in the midst of this brutal wave of the pandemic. I'm wondering, how can health officials convey the right information to the public to combat misinformation about the virus and also about the vaccine? Every day I get on social media and I can guarantee there's some sort of meme that's either delivering misinformation or encouraging skepticism about the correct information.
Yeah, thanks for asking that. That's a really good question. Part of the problem, I think, is that people lose faith in institutions very quickly these days. And I think part of that is, frankly, because the WHO and the CDC would one day, early in the pandemic, would one day say one thing and then a couple days later completely reverse what they had said earlier. Now, that's not due to incompetence, and it's not due to their not wanting to provide information. It's due to this thing changing constantly. There's constantly new information coming out. So, I do think that the CDC and the World Health Organization and most of the well-renowned medical bodies, the AMA and people like that, they're respected, they're well-known, they're good sources of information versus, your buddy who's on Facebook sending you, as you said, Anne-Marie, some silly, piece of information they might have heard at a party or something. So I think people really just need to trust that the people that, the Dr. Birxes of the world, the Dr. Fauci's of the world, these people who do this for a living and do this all the time are giving you the best information that we have. Now, that could be wrong. And in 6 weeks, maybe it's going to be completely wrong, but it's the best information we have at the time. And I think people need to understand that and respect that. And, yes, you're right about the vaccine. And I think that we've discussed this many times on your show that, the polls have showed that upwards of 50% of Americans are afraid to take the vaccine and won't do it. And that's a really scary proposition. And I think people really just need to look at the data and say, okay, I understand this is a new thing, but how safe is this? How good is the data? And do their own research rather than listening to their cousin's friend on Facebook or something who posts some silly thing that, is unverified and it's just nonsense. So you really got to look at the source of your information and where it's coming from and how credible it is. And I think a lot of people don't do that. And I think that's part of our problem.
Dr. Elfenbein, yesterday, Chief Advisor at Operation Warp Speed, Moncef Slaoui, told Face the Nation he's seeing a, quote, light at the end of the tunnel. I want to play a bit of what he had to say.
I think we may start to see some impact on the most susceptible people probably in the month of January and February. But on a population basis, for our lives to start getting back to normal, we're talking about April or May.
And so we know that we saw a surge in cases. We are seeing a surge in cases since Thanksgiving. And at the end of the holiday season, we expect to see more. How significant is it for people not to let their guard down in order to reach this timeline? I know that you heard Dr. Deborah Birx also saying that the vaccine is not going to be the fix-all that everybody's anticipating. Up until we have it, we need to be vigilant.
Yes, absolutely. Even after we have it, we still need to be vigilant. I think, people talk about the new norm, and you can look at the Asian countries where they've had multiple outbreaks of various types of scary and deadly types of influenza viruses. Every year for the last 10 to 15 years around flu season, everybody's wearing surgical masks. Everybody. They go out in surgical masks, they go to school in surgical masks, they wash their hands really well, because it's kind of become ingrained in their societies now because of all these outbreaks that they've had. And we have been spared that here in the United States, but I think that that's about to change. And I think the new norm is going to be people need to wash their hands, wear masks, socially distance, all those things that are so important now, I think we're still going to need to be doing. You're right that the vaccine is not going to be a fix-all, and people still need to be vigilant because, number one, not everybody's going to be vaccinated, and number two, there's still other things out there that can get you. So I think we all need to remember that, and people still need to keep up their guard, so to speak.
Great advice, Dr. Ron Elfenbein. Thank you so much.
Thank you, guys. Stay safe.